Ladies and gentlemen, before we take questions, I have some bad news and I have some good news. This is the bad news. This chart depicts the incredible bureaucratic mess created by this new health plan. Every color, not white, is a new agency, commission, or mandate. Now you'll notice on the left side the word consumer. That's us. You'll notice on the right side healthcare providers. The colored blocks represent 31 new levels of bureaucracy between us and our healthcare. You'll notice down at the bottom, the purple, number 1, Healthcare Choice Administration, or Health Choice Administration. This is going to be headed by a new health czar. This person has been mentioned 200 times in this bill. This Health Choice Administration will be in charge of setting up and running the health insurance exchange, the public health plans, as well as setting standards and benefit levels for coverage offered through the health insurance exchange. This is an unelected, appointed bureaucrat. Number 2, the health insurance exchange. This is the new artificial insurance marketplace. This is where the government sets standards for plans offered through the health insurance exchange and regulates it. And the public health plan, the public option, is also one of those plans. And to be eligible to participate, a plan must be a qualified health benefit plan, and it must conform to a government-specified package. Now, I said that we've got some bad news. The good news is I'm not going to take the time to explain this whole chart because we don't have all night and all day. But let me just mention one other section of it, Section 3. This bill establishes a network of comparative effectiveness organizations. The Comparative Effectiveness Research, that's CER Commission, the Center for Comparative Effectiveness Research, CCER, a CER Ombudsman, a series of CER advisory panels, and even a special CER trust fund, which I think is government speak for tax. This organization will compare effectiveness research, and it's to lay a scientific groundwork for rationing health care. So that means that using the comparative effectiveness research, insurance offered through the HIA may limit the use of certain tests and procedures, like Dr. Greco was telling us about earlier. So it's important. I know it's convoluted. I know it's very complicated. But the only way we can speak about these things intelligently is take the time to read, or at least read summaries of this plan, and talk to your legislators, talk to your families, talk to your friends, and let's speak out. Folks, I know we've been here a long time, but I think it's a good time to go ahead and open up the floor for questions. We do have the roving microphone, so if you have a question for one of the doctors, please raise your hand and we'll see if we can bring you a microphone. Yes, ma'am.
And I certainly appreciate that you've put this on. I have owned a home and paid taxes in Hopkins County for years, but I've been a resident for 1 week. We just got back. I've spent 37 years working for the government in military medicine with both the Army, the Air Force, and the last 3 with Marine Corps. And so I don't scare easily. I'm scared. from what I've heard here tonight, a government that can determine, by virtue of owning our health care, which fetus lives, a 95-year-old, or how old one must be to be valid to stay alive and to get health care, and they admit that, what are they going to admit 2 years from now? That a disabled or a mentally retarded doesn't have the right to medical care? Folks, this is not what my father landed at Normandy for. This is not what I put 37 years in the military for. I'm scared.